do you have low back, hip pain at the same time? So low back and hip. Is it kind of like this low back to hip area right into that glute? Well, if your pain is right about in this area, covering the low back, the SI joint, and some of that glute, you most likely have a disc injury. It's very possible that you could have other stuff such as facet syndrome, which is these little joints back here in your low back that can kind of hurt when you lean backwards and twist. It's possible that you could have that. It's possible that you could have some SI joint pain, but usually when patients come in with this kind of stuff, I want to rule out a disc before I rule out muscle, even if it feels like a tight muscle, joint, nerve, or any of these other associated combos. So first I want to rule out disc, because believe it or not, you could have tight muscles. So if you constantly are foam rolling out your low back or your glute and you have a lot of pain along that area, you want to make sure that you rule out the disc, because a low back disc can actually cause tightening of the spinal and gluteal muscles, because the body's actually trying to protect you from moving into positions that's going to hurt the disc, such as bending forward. So if you have a lot of pain with bending forward in those areas, then it's even more likely a disc. If you have pain with sitting, could also be a disc. Discs hate sitting. If you've ever thrown out your back before and have had a lot of back spasms, could also be a disc. So if you have a history of those things, that also makes it more likely. So any of those things, if it is a disc, you're going to want to try a couple different tests to make sure it is, but there's an exercise that might help you pretty easy. So I'm going to go ahead and demonstrate that video or that exercise for you. So we're just going to go ahead and lay down on our bellies, make sure our back or our hips